Today's focus now, swine flu or influenza A H1N1, to use its proper scientific identity, is sweeping the world. The outbreak, which is now classified as a pandemic, began in Mexico, and it's there that the special international summit is to take place to work out how to tackle this ongoing crisis. This summit taking place in Cancun, one of the first places to feel the economic bite of the outbreak as people cancelled holidays. Only yesterday, the issue of tackling swine flu was discussed in France's National Assembly. There's a media debate in France calling into question government tactics in the face of the infection. For instance, foreign trips aren't restricted and only the worst infections are admitted to hospital. Well, today's focus today is on Mexico and the effect the virus has had there on people's livelihoods. Swine flu caused over 100 deaths there, but touched many more people in so many different ways. The story not over yet.
There's almost nobody on the beach to enjoy the Caribbean Sea. We are in Cancun. Mexico's biggest seaside resort should be in full swing at this time of year. In this city of 1 million people, no cases of swine flu were reported. But 2 months and a half after the outbreak, tourism is still sick. Jorge Eran is the manager of one of the Riviera's biggest hotels. When the flu broke out, he had to reduce his 325-member staff by a quarter, and it hasn't returned to normal since. 74% of the rooms are vacant, when in June there should be no more than 35%.
This, unfortunately, started on the 22nd, 23rd of April, and we saw the drop immediately. After 1 week, we had lost already in between 30 to 50 points in occupancy for the month of May, and then June, and then July, and the forthcoming months, no?
His luxurious swimming pool is desperately empty this morning. The hotel has 8 floors, 3 of them are still closed.
We're saving in air conditioning, in lighting. Inside of the rooms, actually, we have regulators for the air conditioning to keep them to the minimum.
Jorge cut down his prices. Most of his colleagues did the same. Nights for free, breakfast included, but it didn't help. Cancun and the Riviera are losing $280 million per month, according to a Mexican hotel association. Juan de Dios is vice president of the local tourism chamber. He takes us for a drive in Cancun. The damage is visible everywhere.
Look here. Another hotel that's been closed. More than 60 rooms.
On this door, the message is clear. For reasons beyond our control, we stop our activities from the 22nd of April. Further away was one of Cancun's most famous restaurants. Scores of tourists have come here for 25 years to enjoy its eccentric scenery.
Over here, there have been no cases of influenza. Nobody gets sick, but the economic consequences are huge. And this is the best example.
Juan has seen natural disasters such as hurricanes in the past, but nothing compares to this.
The influenza crisis is worse than any hurricane, because at least after a hurricane there's a lot of work to be done. People have to rebuild what's been devastated.
Without tourism, the region suffers. On Cozumel Island, a few miles offshore, 100% of the people live from tourism-related activities. For 1 month, not a single cruise liner made a stop over here. Only in June did things turn slightly better.
Did you hesitate before going to Mexico because of the swine flu?
No. We're obviously here. We just keep our hands washed.
People say it will take months before things get back to normal. The Cancun area is getting prepared for a lost summer.
I think that was the vox pop of the century, that woman saying, no, we're already here. And maybe she thought it was a stupid question, but clearly a lot of people revising their holiday plans and avoiding Mexico, and people there, of course, suffering a lot in this economic downturn. To discuss further the threat caused by swine flu, we have with us here in the studio Professor Christian Perron of the High Council for Public Health here in France. Thank you very much for coming to see us today. In terms of the risk, in your opinion, how great is the risk now of catching swine flu?
So at the present time, the vast majority of cases are very mild, but there are sometimes some severe cases. So we don't know yet if in the autumn, for example, we have 2 scenarios possible. Either the virus remains not so virulent, and it will be a good thing for us, or it could become more virulent with more severe cases. So that's why we have all these plans to prevent this event.
The virus is actually spreading clearly it's a pandemic now, but it is spreading, and this is kind of the opposite to what you would have expected. Summer, you thought, would have killed it off.
We are a little bit surprised for the northern hemisphere because now it's the summer, so the spread should decrease, but the spread is still very active in Europe, for example, or in North America. Of course, in the southern hemisphere, it's the winter, so we expect a large diffusion of the virus in the south hemisphere.
In France, there's a big debate over whether enough is being done to prevent the spread. I mean, clearly, this was debated in the National Assembly yesterday. Newspapers are asking the question, is enough being done? What are you doing to stop it spreading?
Every day, so some people say we do too much and others say we don't do enough. I think we are adapting all the recommendations according to the course of the epidemic. At first, people were strictly isolated in hospital wards. Now, people are seen in medical consultations, but most of them can go back home with antiviral treatments. So that's well organized. Now we are all expecting for a future vaccine, but we don't know exactly when it will be available.
Okay, would you, personal question now, would you, if you had the offer, if I said to you, here's your ticket, here's your hotel, go to Cancun, go to Mexico, would you go?
I think now that the virus is everywhere, even in Paris, so I'm not sure I would be more afraid in Cancun than
So in your opinion, there's no greater risk if you go to Mexico? There's no reason to avoid Mexico now?
No, of course you can get the flu, but fortunately at the present time usually it's a mild disease, but it may be more severe in the future.
Okay, thank you very much for that. If you stay with us, please, Professor Perron, that'd be grand. We'll go now to Latin America, to our correspondent there, Ion Grillo, who's waiting to give us a little bit more about the effect that this has had on Mexico. Ion, tell us a little bit more about how. We've obviously seen the report with hotels closed, with rooms empty. What's been the overall knock-on effect of the swine flu outbreak?
Well, it's been absolutely devastating, as you saw in the report, on the Mexico's tourist industry. Now, Mexico's tourist industry is very important for the country because it provides about $18 billion per year. It's the third biggest source of foreign income after oil exports and remittances sent from the United States. Now, $18 billion in itself is not a huge percentage of the whole economy, but in certain regions, like in Cancun, in Acapulco, and other tourist places, it is the main employer. And when tourism dives down like it did, absolutely devastated from 80-90% capacity to sometimes single digits immediately following the swine flu, those communities are in real trouble.
And clearly, you're in Honduras now. Has there been a similar effect in other Latin American countries?
There hasn't been the same effect as in Mexico at all. Mexico was the epicenter of the swine flu outbreak, of the H1N1 outbreak. Obviously, Mexico took very hard preventative measures by closing down the whole country, closing down restaurants, schools, businesses, really shutting down the country in the first days of the swine flu to try and stop the spread. But it also really drew attention to Mexico as the site of the virus. In other countries, Latin American countries, they were actually punished Mexico. They shut down flights to Mexico and tried to stop people going, there. So they were, actually punishing it economically for the outbreak. Another country now which is starting to see a big spread of swine flu is Argentina. And that's because Argentina is in its own winter months when flu is normally more prevalent.
Ion Grillo, thank you very much for that insight. I'll come back now to Professor Perron. What would your advice be, Professor, to people to avoid catching this virus? What precautions should they take?
They should be aware they are in contact with somebody with a fever or cough, and sometimes wear a mask to protect themselves, and to wash their hands several times per day, because the transmission occurs also by handshaking.
And in terms of people's fears, because whenever anybody sneezes or sees somebody sneeze, everyone thinks, ooh, swine flu. Just because someone has a cold or a version of the flu, it doesn't necessarily mean it's influenza A H1N1, does it?
No, because of course most of the when you are sneezing with a cold and a low-grade fever, usually it's not flu. Flu usually it's high-grade fever and high fatigue and so on. So it's a little bit different.
Okay. I think most women say that men sneeze and they say they've got the flu, don't they? So it's a whole different debate. Let's not go there. We haven't got time to discuss it, I'm afraid. Professor Perron from the High Council of Public Health here in France, thank you very much for joining us.
Thank you.
That was today's focus, the effect on the economy of swine flu. You've heard about the precautions you should take, and don't fear about travelling. Just take those precautions. Stay with us.